Everybody, my name is Julie Condon. I thought today that I would just go through a few of the tools of the trade of hand therapy. Most of the things are very similar to other therapies. Physiotherapists use some of these equipment and some are very specialised to hand therapists. So first and foremost, we need a really good pair of scissors because our thermoplastic that we use which is what we make our splints out of, so this is thermoplastic. If you don't have good scissors, it makes it nearly impossible to cut it, and it also then puts our hands at risk, particularly your thumb joints, which we don't want. So good pair of scissors is a must, and then to have them nice and sharp is perfect. We measure people's movement, so this is called a goniometer, and this is what we use to measure people's movement. So this is for a wrist or an elbow, so if you can see, I just line it up like that and then move it around so that then it is level with the joint axes, and then what that does is it has numbers around the side and it tells me how much movement people have got. We can do that for wrists, and then we also have a baby one that we use for fingers. Now the benefit of these guys is that it shows us to the degree how much movement you've got. It really helps as you're improving, because sometimes you come in and you're like, oh, I think it's a little bit better, but I'm not really sure. We can actually test to the degree whether or not it's any better. So, or alternatively, if it's any worse. So that helps us as well. Another tool that we use quite a lot is our trusty dynamometer. This guy is like a fancy set of scales. So basically it's a hydraulic force tester. So basically what we get you to do is just hold your arm in by your side and then squeeze as hard as you can, and then there is a gauge on here that tells us how strong you are, and it's in kilos and pounds, which is quite nice. We also have a baby one, which is for the pinch. So this one tests exactly how much strength you've got in your thumb, in all the different positions, just to get us more accurate. So like the goniometer, it just helps us to be very accurate with our testing so that we know whether you're stronger or not. It's much more accurate than if I just get you to squeeze my hands and then I try and remember how did it feel last time compared to this time, when it could be 2 weeks in between. There are standardized norms as to how strong we think people should be as well, which really helps. So we have lots of other tools. These guys are ones that we use to test sensation with. They're basically little bits of fishing line on a stick, and it helps us to know. Same thing, it just gives us really accurate diagnoses of what you can feel and what you can't. So sometimes people will come into us and they say, oh, my fingers are numb, I can't feel anything, and rather than me just saying, oh, does this feel the same as this, and rubbing different fingers, which doesn't really tell us much and it's not very accurate, this guy goes through and it goes through all the different levels of force, so that then we can find out how much where exactly your sensation is at each different part of the hand compared to the other. Helps us to figure out what's going on, and also helps us to be really accurate because they're in the grams of force, so we can figure out how the improvement is going, or conversely, if things are not going well in terms of nerve regeneration and things like that, we can have a good idea of that. I have lots of other tools of the trade, but those are just a few of the quick, easy ones that I use every single day and with pretty much every patient. So thanks for watching. Thanks.